So hopefully by now you're pretty comfortable with the idea that the job of the cardiovascular system is to provide transport. Like that's what it's doing. It's moving things around the body. So how does it do that? Well, it carries all of this blood in arteries, veins, and capillaries. So we should talk about how they're organized, starting with how they leave and then naming the types of vessels. So we'll have a heart here. We're going to leave. And when we first leave, there's a lot of force. Those ventricles squeeze really hard, and they're going to push things out into arteries that need to be able to surge with that pressure and then come back. So in their outer wall, they're going to have elastic fibers to kind of account for that return back to their normal shape to maintain blood pressure. So our first one out is going to be an elastic artery. From an elastic artery, we're going to go to muscular arteries. Now, do remember that muscle here in the vessel walls, that's smooth muscle. Cardiac muscle is only in the myocardium of the heart. So we have smooth muscle here in the muscular arteries. Then we're going to go arterioles. It's one of those fun things in anatomy. As the structure gets smaller, the word gets bigger. So arterioles are just little arteries. So these are the last ones that are going to hand you off to the place where you're going to do exchange. The place where you do exchange is a capillary. So you'll drop some stuff off of the tissues, basically resulting in a push and a pull setup. So here's your vessel. And so we have some large proteins in there, some fluid, some cells. And so you'll have a physical push out, that's your hydrostatic pressure, and specifically a blood hydrostatic pressure. But then as water leaves, the concentration is going to get higher towards the venous end. So let's say this is the arterial end, this is the venous end. And so as the concentration gets higher, you're creating a chemical gradient. And so water is going to get sucked back in because of osmotic pressure. And so we call that blood colloid osmotic pressure because it's based on the blood's colloid, so plasma proteins, specifically albumin being the big one for this. And so you're going to drop off some and you're going to suck some stuff back up. So it's kind of a circular motion. Now, the amount and what you allow out depends on the type of capillary you have. So with capillaries, there are three options. You have a continuous, a fenestrated, and a sinusoidal. Now that's going to put you in order for how much they let through it. A continuous is exactly what the name says. You have a simple squamous epithelium on a basement membrane, and it's got no holes. The only things that are going to go through it are things that can do simple diffusion. And then anything you have a channel for. The fenestrated, now you have little holes. So you can start to let things like small dissolved charged particles through. So ions can travel through here really well. Sinusoids are big gaps between the cells. Now this is really useful for places where you need cells to go across or proteins to go across. So like in the liver, for example, where you're first making these plasma proteins, you have to have sinusoids there to put those plasma proteins into the blood. Fenestrated, a really good place for that would be like the kidney. You're giving the kidney a sample of your blood, and then it's going to adjust it as it kind of works its way through different tubes in the kidney to say, yep, we need this, or no, we have plenty of that in the body, so we can adjust what's left over and what gets left as urine. And then continuous, that's the most common. That's where you see it across your body, where you're dropping off gases, nutrients, you're picking up waste, and the other gas. So dropping off oxygen, picking up CO2. So that's really what's kind of happening at those capillaries. Now we're going to start working our way back to the heart. And so we're going to pick it up on the venous end with venules. And they're really creative on the names here. Then we'll have medium-sized. So we have medium-sized veins. Then we're going to go large veins. And so that would be like a superior and inferior vena cava. And then back to the heart. So that's your basic flow. Artery away, so A away, artery leaving. Capillary exchange, veins return. So venules to medium sized to large bring you back. Now remember some things with your veins that make them a little bit different than arteries. Remember these arteries over here dealing with a lot of pressure, their walls are thicker. They have the elastic fibers and a lot of smooth muscle in them. On the vein side, you have low pressure and you don't have a pump to help push you back. So the way that this works is you'll have a muscle that'll push on this and it'll move you up one compartment at a time. And then a skeletal muscle push on this and then it'll move it up one compartment at a time. Then it'll flow back down and then the door shuts. These are valves. Valves exist only in the veins. All right, now this is a typical blood flow. There is however, some exceptions. Well, there are, I worded that weird. There are some exceptions to this. And one of my favorites to talk about is when you would go through two capillaries. And that is what we call a portal system. So normally you go artery, capillary, vein, back. But in the case of a portal system, you're going to take a portal vein from a capillary to another capillary. And then you take a vein back. It's got an extra stop. So why would we ever use that? My favorite way to think about this one is your digestive tract. So we're going to take these arteries out towards the intestines. You have capillaries there to do exchange. You're picking up nutrients. You could also pick up pathogens. So send it somewhere to be checked over, and it also gives them dibs on the nutrients. So we're going to take a hepatic portal vein to the capillaries in the liver, which we just talked about, are sinusoidal. And so if you have a pathogen, there's a lot of white blood cells there, but also remember that the liver is doing things like making plasma proteins. Give them first pick of all of those amino acids you just absorbed at the intestines. So the liver gets first pick. So the capillaries are in the liver, those sinusoidal ones, and then you'll take a hepatic vein, a normal returned back vein, to the heart. So we'll go artery, capillary, portal vein, capillary, regular vein, back to the heart. All right, everyone, hope that makes sense to you.